Our topic for today is alcohol use and COVID-19. I'll start like this. In no way will alcohol consumption or alcohol use protect or prevent anyone from contacting COVID-19 virus. Within this period of COVID-19 pandemic, we have all been subjected to a number of rituals like washing our hands regularly, maintaining social distance, using alcohol-based hand sanitizers, and a lot of other things that we have to do to prevent or to protect ourselves from this virus. So the concept of using alcohol-based hand sanitizers has made a lot of people to think that alcohol on its own can protect them or prevent them from contacting COVID-19. A lot of people think that consuming alcohol will make them not to contact this virus. But when people consume alcohol, it's going to make them to have health risk even when they get, let's say, after maybe if they now get the virus. So if, for example, the person is consuming alcohol and the person gets COVID-19 virus, the person will have more health risk because of the consumption of alcohol. And also, alcohol at 60% concentration volume can serve as a disinfectant on the skin, not when consumed or when drank. So when we have a solution that has about 60% alcohol concentration, that solution or mixture can form or serve as a disinfectant, maybe when we are talking about hand sanitizers, but it cannot serve as a protection from COVID-19 when you drink it or when you ingest it into your system. So when it enters into your body, it's not going to protect you from COVID-19, but it can only serve as a disinfectant when it's rubbed on the skin surface. Okay, so some people also believe that consuming alcohol, strong alcohol, is going to help them boost their immune system and make them resistant to COVID-19. But what alcohol does is that alcohol reduces our immune system. It makes us vulnerable to infections. So when your immune system is down as a result of the alcohol use, it can make you vulnerable to COVID-19. Then some people also look at it that alcohol use help them to cope with COVID-19 situations and all the other complications or issues arising from it. But coping with alcohol is not a good coping mechanism, because what it does is that it instigates anxiety, it makes you depressed, it makes you have panic or fear of what is happening. Then it takes you to drink alcohol. Once the alcohol wins out of your system, you go back to where you are coming from, which is the anxiety or the depression or the fear. So you find yourself going round a cycle that you cannot break yourself out of. So it doesn't really solve your problem, but it takes you around a circle that you might not be able to find a way out. Also, when people drink alcohol, we discover that it makes them vulnerable to domestic violence, women abuses. They perpetrate a lot of abuse and commit a lot of crime. So now they can find themselves beating their wives, beating their children, some even engaging in sexual abuse and all those. And also, it has been found that women that are victims of domestic violence also drink alcohol just to cope with the abuse that they face. So you see that alcohol is not a good coping mechanism for anybody, but it takes you around a cycle that you find it difficult to break yourself out of. So if you have issues with alcohol, or if you have alcohol use disorder, I think this is a very unique opportunity or very unique situation that you can stop the alcohol use or even cut down on your use. Because within this period, all the triggers, all the environmental triggers, most of the I'll say most, okay, most of the environmental triggers like party, clubbing, birthdays, wedding, activities, all the social activities has been reduced drastically. So basically, all those environmental triggers are not available. So it will be much easier for you to deal with the disorder while in the confines of your home or with limited external activities. So now, I have some tips that can help you with cutting down or stopping the alcohol use. Within this period, most of us work at home. So when you work at home, you don't assume that you are at the leisure of doing anything you like. Assume the same working condition. Don't work and drink. Even when you're on break period, don't drink, because if you are in your office, you won't drink. So if you have to work between 8 and 5, within that period, don't bring alcohol close to you. The second thing is, when you go to buy things, you don't stockpile your house with alcohol. You don't put alcohol as the first priority in your list. You don't go about shopping for alcohol and stocking your house with it. Because when you don't have it at home, it reduces your chances of drinking. Another one is, don't drink in the presence of children or young adults. If you have your children at home, let them serve as a deterrent to you to drink. Don't find yourself drinking in their presence, and don't even initiate them or give them some to drink. Because when you do that, you are initiating them to a challenge that you yourself have not even find yourself out of. So in the future, they can reference the fact that their father gave them alcohol, and that might be the beginning of their problems. Then another one is, when you are at home, instead of using alcohol to while away time or to cope with boredom, try to engage in exercises. Try to engage in your hobbies. Try to engage in the things that interest you. Do things that you like. Do workouts, indoor workouts. That will help you to cope with boredom or manage your leisure time. Then get a trusted friend, somebody you can reach out to, somebody you can talk to, somebody you can tell whatever that is happening with you, so that that person can form as a support for you. Also, instead of maintaining, you can only maintain social distance, not social isolation. So now you are distancing physically, but not socially or emotionally from your friends. So you still relate with your friends, relate with your colleagues, relate with your family members through texts, calls, or any other means that you can relate with them and still maintain safety. Then, while at home, try as much as possible to regulate your emotions. If you find it difficult to control what is happening around you, reach out to anybody, reach out to people around you, reach out to friends. If you find it difficult to control your alcohol use, seek professional help. Reach out to the professionals so that they can help you within this period to control your alcohol use. Remember, don't take alcohol to solve COVID-19 issues. Don't take alcohol as a means of preventing or protecting yourself from COVID-19. If you have issues with alcohol, seek help. Thank you very much for listening. Bye.